Our vision is precious, and it can be seriously challenged by age-related macular degeneration, or AMD. Dr. Talia Kaden is an ophthalmologist for the Manhattan Eye, Ear, and Throat Hospital. Good morning.
Good morning.
So the beginning here of this conversation is, what exactly is age-related macular degeneration?
Yeah, so age-related macular degeneration is a disease that impacts over 20 million Americans. And of those 20 million, about 1.5 million have what we call wet macular degeneration. And wet macular degeneration impacts the macula. So this is the central part of the back of the eye that helps you with your clear vision. And you can develop these abnormal blood vessels, which can leak or bleed and can cause permanent vision loss.
So who's most at risk for AMD?
So as the name implies, it's mostly older people. So people over the age of 60 are at higher risk, but it also is more common in women. It's more common in people who are smokers or who have high blood pressure or are overweight. And if you have a family history of the disease, you're also at a slightly higher risk.
What are some of the symptoms we would notice to know immediately to come to our doctor?
So some of the symptoms are pretty nonspecific. They can be things like blurry vision or, some blurriness, particularly in the center of your vision when you're looking, for example, at your family member's face. But there's also things that are a little more specific, and these include straight lines that start to look wavy. So I always tell my patients, if you're looking at your bathroom tile or you're looking at a flagpole outside and it starts to look bent instead of straight, then that's a reason to go and see your eye doctor immediately to make sure that everything's all right.
Is this a disease that would be detected if you have a yearly eye appointment?
Yes, so if you're seeing your eye doctor regularly, they will be able to identify whether or not you have macular degeneration, but there can be changes over the course of that year. And if you start to notice that change, or if you take care of somebody and they're complaining that their vision is changing, you want to go and be seen immediately. Don't wait to be seen by your eye doctor, because as I said, if you have wet macular degeneration, the earlier we can identify it and treat it, the more vision we can protect.
Well, we mentioned treatment. What exactly is available for a treatment?
Yeah, so for wet macular degeneration, the mainstay of treatment is injections of medication into the eye. And these medications can be given anywhere from once every month to once every 2, 3, or even 4 months. The most recently approved medication is a medication called Vabysmo. But as with every drug and every medication, we always recommend that you go see your eye doctor and talk to him or her about what the best treatment is for you.
And are you happy with the results from these medications?
Yes. So I often tell people, I have 2 great aunts who have macular degeneration, and one of them was unfortunately diagnosed well before these medications were available, and she was legally blind, had no central vision. But I have another great aunt, a few years younger, who was diagnosed after these medications were available, and she's in her 90s and can still play tennis. So I do really see that not only in my family, but in all of the patients I take care of, that we can make a huge difference in terms of trying to protect the vision that they have if we are able to treat them early and often.
Can you send my viewers to a website, please, Dr. Kaden, where they can learn more?
Absolutely. So if you're interested in the medication I mentioned, that's called Vabysmo, and it's vabysmo.com. But for more information about macular degeneration in general, I always recommend the American Academy of Ophthalmology has a great site, aao.org, or the American Society of Retina Specialists, asrs.org. And both of these sites have really great resources available for people, for their families. They have handouts you can print out that give you information about the disease, about the symptoms, and about the treatments available.
Dr. Kaden, thank you so much for all this important information.
Thank you so much for having me.
And we'll be back with more local lifestyle. Stick around.